Welcome to our 212 project. This is AC8. Today we're going to be talking about smoking cessation during pregnancy. The members of our group are Giselle, Georgette, Jenny, and me, Andrew. So we picked the Healthy People 2020 goal of increasing smoking cessation during pregnancy. 11.3% of women aged 18 to 49 quit smoking during their first trimester and remain cigarette-free for the remainder of their pregnancies. The goal is to reach 30% during the first trimester. In 2010, we hit 18.9%. In 2015, we hit 17%. There's been a gradual improvement, but we're still far from the goal. So what is being done? Through our research, we found that there are many effective anti-smoking campaigns, both on television and in text message form. These ads are not directly related to pregnant women, but are shown to have an impact on smokers overall. We felt that nurses can have a huge impact in reaching the target goal by bridging the gap where the ads either don't reach or don't target pregnant women. There's also pamphlets and handouts that are often given out at the obstetrician's office. So why should nurses care? Since 110, we've been taught that one of the roles of a nurse is to promote health. The WHO, or World Health Organization, describes health as a state of optimal functioning or well-being. If we can intervene in helping a pregnant woman stop smoking, we are reaching two patients at the same time. This presents a unique opportunity for us. Smoking is a direct insult to the health of the future baby. Through research, we found that the anti-smoking campaigns work, but only if our target audience sees them. Nurses can help bridge the gap. What we hope you will get from this presentation. Our objective is to give you the knowledge and skills to intervene and help increase smoking cessation among pregnant women. We can't just tell moms to quit. We need to educate them on why and how. We will cover the effects of smoking on both the mom and the baby, barriers to cessation, and steps to help implement quitting. We will also talk about relapse in a mother who has already given birth. Next is going to be Georgette to talk about the ill effects on both the mom and the fetus.
Negative effects of smoking in pregnancy. Smoking during and after pregnancy is associated with fetal and infant risk. These include number 1, low birth weight, number 2, preterm delivery, number 3, abruptio placenta and placenta previa, number 4, sudden infant death syndrome, 5, an increase in childhood respiratory illnesses, and 6, there's also evidence of possible cognitive effects associated with learning disabilities and conduct disorders. Low birth weight. According to the American Lung Association, smoking during pregnancy is estimated to account for 20 to 30% of low birth weight babies. Smoking increases the risk of preterm labor. Babies born too early can suffer from breathing problems and have longer hospital stays. Placenta abruptio is a condition in which the placenta separates from the wall of the uterus, denying oxygen to the baby. It increases the risk of a preterm birth. Due to the separation, babies tend to be smaller, resulting in low birth weight. And this is associated with many problems of the baby. This includes poor lung function and can lead to preterm labor or premature rupture of the membranes because the body feels that the baby can no longer be fed properly. Cigarette is associated with a 2.5-fold increase in severe abruption, resulting in fetal death. The risk of abruption increases with the number of cigarettes smoked per day, with a threshold effect of approximately 10 cigarettes per day, after which the risk remains constant. According to the CDC, sudden infant death syndrome is the leading cause of death in otherwise healthy infants. Secondhand smoke increases the risk of SIDS. Smoking by women during pregnancy increases the risk also for SIDS. Infants who are exposed to secondhand smoke after the birth are also at greater risk for SIDS. Compared to babies of non-smokers, babies whose mothers smoke during pregnancy are up to 3 times more likely to die from sudden infant death syndrome, according to the Marshall Dimes. According to evidence by the CDC, it displays that babies who have been exposed to smoke in the womb from secondhand smoke have more genetic defects. Symptoms caused by secondhand smoke in children are the following: pneumonia, ear infections, lung damage, more asthma attacks, and more allergy problems. Therefore, an increased risk in childhood respiratory illnesses occurs with smoking. Okay, as the nurse, it's important to educate the mom about the increased risk of damage to the fetus during utero due to smoking, and this increases the risk of ectopic pregnancies, premature rupture of the membranes, placental complications of pregnancy, premature delivery, and spontaneous abortion. Long-term health risks to women who smoke are also heart disease, can occur cancer, early death, increased risk of hypertension, diabetes, and also there's links to many other diseases and health problems. Smoking remains a major public health crisis. Successful smoking cessation strategies supported by clinical evidence should be integrated into routine prenatal care for every woman. And so finally, next, Giselle will be speaking about smoking cessation strategies.
Smoking during pregnancy remains a major public health problem. Despite the well-known health risks associated with smoking, many women continue to smoke even after learning that they are pregnant. Smoking during pregnancy is the most modifiable risk factor for poor birth outcomes. The American College of Obstetrics and Gynecologists recommends that obstetric healthcare providers screen all patients to determine whether they smoke and offer treatment for smoking cessation. Quitting smoking not only reduces risks for health problems for the baby and complications during pregnancy and delivery, but also benefits the mother's long-term health. A brief 5-step intervention program referred to as 5A's model is recommended in clinical practice to help pregnant women quit smoking. The 5A's include ask the patient about the tobacco use, advise the patient to quit, assess their willingness to quit, assist the patient in their attempt to quit, and arrange follow-up. First A, ask. Ask the patient about her use of tobacco at every prenatal visit. Use the standardized multiple choice questionnaire to ask patients about smoking status. As the healthcare provider, you would ask your patient, which of the following statement best describes your smoking history? Some of the answers on the questionnaires include, I never smoked, or I have smoked fewer than 100 cigarettes in my lifetime. I've stopped smoking after I found out I was pregnant and I'm not smoking now. Or I smoke regularly now, about the same as before I found out I was pregnant. As the healthcare provider, you will record the smoking status as a vital sign on the patient's record. The second A is advise. Advise all pregnant patients to stop the use of tobacco. Your advice should be clear, strong, and personalized. During the advise stage, also provide pregnancy-specific educational materials about health risks and the benefits of quitting for the mother and the baby. Also, state positive effects of smoking cessation, not negative. 9 times out of 10, pregnant women will quit if they know the positive effects of smoking cessation. Positive effects of smoking cessation during pregnancy include your baby will receive more oxygen even after 1 day of not smoking. There is a decreased risk for your baby to be premature. You will have more energy and be able to breathe more easily. You'll be less likely to develop heart disease, lung cancer, chronic lung diseases, and other smoking-related diseases. Your food will taste better, and you will feel good about what you have done for the health of your baby and yourself. The third A is to assess. Assess the patient's willingness to quit smoking within the next 30 days or by the time of their next follow-up appointment. If the patient is willing to quit and is committed to trying within the given time frame, the healthcare provider can continue to the fourth A, assist. If the patient is not ready to quit or unwilling to make an attempt, provide motivational intervention, the 5 R's. The fourth A is assist. Help the patient set a quit date. Provide self-help materials and problem solving. The quit date is set within the next 30 days. Encourage patient to tell family and friends about her decision to quit and request support. Prepare her for nicotine withdrawal symptoms and instruct the patient to remove all tobacco products from her environment. Review past attempts to quit to identify strategies that have helped and what contributed to relapse. After the patient has stated that they will quit, timing of health benefits after smoking cessation. 20 minutes, your heart rate drops. 12 hours, carbon monoxide level in your blood drops to normal. 2 weeks to 3 months, risk of heart attack drops. Lung function begins to improve. 1 year, risk of coronary artery disease is half of that of smokers. And 5 to 15 years, stroke risk is reduced to that of a non-smoker. The fifth A is arrange. Make plans to monitor patient smoking status and provide continuous support during follow-up prenatal visits. Ask the patient about how she's feeling about quitting. Directly express concern and willingness to help. Ask patient about strategies that has been working for her. For the patient who declines to make a quit attempt during the advised step may have reasons for not quitting and she is unable or unwilling to express. For this patient, you would use the motivational interventions, the 5 R's, which Jenny will be talking about next.
For the patients who do not have a desire to quit and are in the pre-contemplation phase of change, the nurse primary focus is on the 5 R's, and they are relevance, risk, rewards, roadblocks, and repetition. In relevance, the nurse needs to encourage the patient to discuss why quitting may be personally relevant. For example, because they have children in the home, to help her identify motivational factors on her own. The idea is to link the motivation to quit to the patient's personal situation, being as specific as possible. In risk, the nurse needs to ensure that the patient understands the risk to her own health and to her baby's health if she continues to smoke. Ask her to identify potential negative consequences. One way to begin this part of the discussion is to ask. In rewards, ask the patient to describe how quitting smoking might benefit her and her family. Depending on her situation, she may need some examples, such as you will have more energy to take care of yourself and your new baby, or you will set a good example for your children and their friends. The patient's history and comments about her smoking behavior can provide vulnerable information to create a checklist of factors that will increase her motivation to quit. For example, saving money, taking the baby from the hospital with her, protecting a child who has asthma, less time required for smoking related doctors. In roadblocks, most patients can easily identify barriers to quitting. Reassure the patient that assistance is available to help her overcome roadblocks, such as withdrawal symptoms, weight gain, another smoker in the house, and emotional consequence, problem solving, strategy, and tools, including information, can be applied to many situations once roadblocks are identified. In repetition, follow up at each visit to see if the patient has changed her mind about undertaking a quit attempt. Tell patient who have tried to quit and relapse that most people make repeated attempts to quit before they are successful, that she can learn from repeat quitting attempts and catch new attempts increase the likelihood of quitting. For a patient who does not respond to the 5R intervention, it may be useful to provide information about how to get help if she changes her mind. As we all know, it is always hard to get rid of a bad habit. It takes strong will and dedication, especially when a pregnant woman have to overcome those barriers on quitting smoking. And those barriers are negative mood, being around other smokers, triggers, time pressures. So in negative mood, you can advise the patient to keep self preoccupied, like participating in physical activities such as walking and dancing, taking 10 slow deep breaths, talk to a friend, express yourself through blogging or journaling. Remind yourself that you are a non-smoker. In being around other smoker, we need to advise them they need to spend more time with friends who don't smoke. Ask others not to smoke around you. Establish a smoke-free zone in the house or car. Walk away from smoker when you feel like smoking. In triggers, identify and anticipate situations that prompt cravings, such as social gatherings, being on the phone, waking up from sleep, or stressful situation. Change your routine after meals and after waking immediately, brush your teeth or take a walk. Engage in distracting activities. Take a walk, knit, garden, read, participate in a hobby, or listen to music. Time pressures. Change your behavior or lifestyle to reduce stress. Use physical activity such as walking. So Andrew is going to give us some tips about relaxing.
So I'm going to be talking about relapse prevention. So our mom gave birth and she's thinking about going back on cigarettes. We want to educate her and we want to engage her in continuing to stop smoking even after the baby is born. This benefits the mom's health directly and reduces the threat of secondhand smoking to the baby. According to the Mayo Clinic, many mothers report that quitting was relatively easy during pregnancy. Women have reported having easier withdrawals and lowered cravings for nicotine. There is social pressure when people see a woman with a baby bump smoking. There's a good chance that they'll say something. Makes a lot of people very angry. And there's the motivation for a healthy infant. Women report that one of the number one reasons why they stop is because they don't want any ill effects for their child. Why do moms relapse? Stress is a major trigger. We have the financial concerns. They just had a child. The child's going to need diapers, clothing, toys, crib, formula. There's also the weight concern. The mom might have put on a bunch of weight during the pregnancy. A lot of people still attribute smoking to keeping your weight down. There's the sleep deprivation. This is going to add to the stress if the baby's not sleeping during the night. There's the life changes. If this is a new mom, she's not used to this role, she might not be able to go back to work. Her life is completely flipped upside down, and now she has a child that's completely reliant on her for everything. You can also have relationship problems. Maybe the father's not around. Maybe the role of raising this child has completely fallen on the mother. Maybe the father is not engaged with taking care of the child. Maybe he's not changing the diapers or helping with feedings. There's less social pressure. People are more concerned with a woman with a baby bump smoking than they are with a woman who's pushing around a stroller who's smoking. The mom might also start consuming alcohol again. This might lower her inhibition. She might forget about choosing to quit smoking and start smoking casually, and then that she can be right back up to regular smoking. A smoking spouse or somebody in the home who's also smoking, this is going to make it really difficult for the mom to quit. And she also might have poor coping skills. Earlier I mentioned stress, and if she's not managing that stress well, she's going to go right back to smoking cigarettes to try to manage that stress. So what can we do to prevent relapse? The best thing we can do is to teach new moms the negative effects on smoking on their babies. Like I said earlier, a lot of moms end up quitting because they're concerned about the ill effects on the fetus. Now that the baby's out, we want to remind her that the secondhand smoke is really dangerous for that new child. Immediately after the baby's born, we want to reaffirm her commitment to quitting. If she has a spouse or family member at the home who smokes, attempt to educate them on quitting as well. If a mom returns to a house with smokers, there's a good chance she's going to start again. And it's also not a great environment for that baby. This is a great time to educate the mom on the negative effects of smoking. We're going to try to shift her motivation from the health of the unborn child to her own well-being. So we want to consider the risks and benefits of nicotine replacement therapy. Now that there's not a baby inside of this mom, it might be a good time to consider something like a nicotine patch or the nicotine gum. With that, we want to teach the mom something called pump and dump. She's going to want to breastfeed before she puts on that patch or before she chews that gum to limit the amount of nicotine that's going to the baby. If she uses a pump, she would dump that milk to help limit. We're going to teach the mom behavior modifications and positive coping skills. Jenny mentioned it earlier, but things like exercise or hobbies are great here. We want the mom to have distractors to keep her mind off of cigarettes. We're also going to teach the mom to avoid triggers like caffeine and alcohol. A lot of people, first thing they do when they wake up is they have their cigarette and a cup of coffee. And a lot of other people started smoking just casually drinking at the bars. We're also going to reinforce the dangers of secondhand smoking. Secondhand smoking is a direct insult to the health of the baby, and we want to keep them out of an environment that's going to reduce their wellness. So that's the end of our slide. We hope you learned a lot. We really wanted to push how important this Healthy People 2020 goal is. There's a huge difference between the 11% to the 30% goal, and with the help of nurses, we can really help bridge the gap between that. We felt through our research that enough was not being done to directly target pregnant women, and nurses are at the front line to help educate these women and help them lead the healthiest lifestyle possible. Thank you.